Hi, I'm Dr. Elyse Rubenstein, and I'm the medical director of Mirmont Treatment Center. I'm here to say a few words about alcoholism during the month of April, which is Alcoholism Awareness Month. Alcoholism is a chronic brain disease and a medical illness, not dissimilar from other medical illnesses with which we are very familiar, such as asthma, diabetes, and hypertension. What alcoholism is not is a sign of weakness, a lack of willpower, or simply bad behavior. Alcoholism has a very strong genetic component. This means that many of us are born with a vulnerability to develop this disease at some point in our lifetimes. Add to this genetic vulnerability traumatic life events, and we have set up the perfect storm for the development of this disease at some point in our lives. It is a common disease. It is found in all races, ethnicities, ages, socioeconomic backgrounds. It is the second most common addiction in America, exceeded only by tobacco addiction. It causes a multitude of health problems and affects all organ systems. It is particularly dangerous and damaging during pregnancy. Most importantly, alcoholism is a treatable disease. Yet, of the 18 million Americans who have it, only 1 in 10 receive treatment. That means that 90% of alcoholics suffer needlessly in spite of the excellent treatments that we have available, including specialized psychotherapies, 12-step support groups, which are also functioning, by the way, virtually during the COVID pandemic, as well as excellent medication treatments that have been shown to be effective and evidence-based in helping people maintain their sobriety. It is easy to see how the COVID pandemic is a public health crisis. But in reality, addiction, including alcoholism, also constitutes a public health crisis. And as we deal with a lot of uncomfortable feelings arising during this time, including loneliness, boredom, depression, anxiety, it is easy to see how people would turn more urgently even to alcohol and other substances to numb some of these uncomfortable feelings. Unfortunately, this relief is very short-lived and carries with it a multitude of other problems, including worsening mental health symptoms, physical symptoms, actual sleep disturbances, and surprisingly and importantly, an actual weakening of one's immune system. Having said all of this, it is also important to understand that it is not safe or recommended to abruptly stop drinking on one's own, because alcohol withdrawal is a dangerous situation potentially that can actually be fatal in a small percentage of cases. The better solution is to reach out and ask for help, even during, or maybe I should say especially during, trying times such as these. Thank you.